Lenore Walker, and I'm chair of the COVID IPV task force of the American Psychological Association, which means we're a group of mental health professionals who are doing these Thursday roundtables. We're trying to help those of you who are also mental health professionals, but those of you who are also people just going through this COVID pandemic like we are. And every week we try to take a topic of information that we can share with everyone. And today we have a very exciting topic. We're going to talk about how to stay fit during COVID with good nutrition. I just learned from a doctor's visit that we're all gaining COVID weight. At least I'm partly part of that group. So I'm really interested in listening today to some good tips on nutrition and healthy ways of staying fit. I'm going to introduce those people who we can see on our Zoom call in a moment, but we're also going to be recording this video, and it's going to be shown on Facebook. We have our COVID IPV page on Facebook, and we also, because we're collaborating with the interpersonal whole person approaches to psychology group as well, and it will be on their Facebook page as well. So with that, let me introduce who's here. You've probably met Giselle, Dr. Giselle Gaviria. She's here in Fort Lauderdale. And as I said, I'm Dr. Lenore Walker, and I'm here in Fort Lauderdale. If you couldn't tell, it's a beach scene behind me, which really is true. That's where we live. We also have Dr. Patricia Villavicencio Carrillo, who is here with us from Madrid, Spain, and she is going to introduce our guest in just a moment. And we have almost Dr. Brittany Geddes, who is here with us from Pennsylvania. We have Dr. Marilyn Safer, who is here with us from Haifa, Israel. And we have Dr. Eric Pepper, who is here with us from San Francisco Bay Area, and Dr. Michaela Mendelson, who's here from Boston. So you can see we're very varied group. We'll see other people who will be jumping on because we're all busy practitioners, and we take this time every Thursday so that we can share information with each other as well as with you. So with that, I'm going to turn it over to Dr. Villavicencio, who is going to introduce our guests today. So please take it away, Dr. Villavicencio.
Thank you so much, Lenore, and thank you to all of you and Diego for being here today. And I have the great pleasure to have met Diego not long ago, and I interviewed him in my Entrevistas con Inspiración, Inspirational Lives interviews in Spanish, and he taught anyone who would understand Spanish. It's available in my YouTube. And just two words that I want to mention: my mother's philosophy in nutrition. She was really an, I would say, visionary about how we should eat. And so the best thing that she taught me is to have breakfast, and healthy breakfast. And on the other side, being a clinical psychologist, we all know that psychological problems and psychopathology affects our I will say how we eat and what we eat. And sometimes when we have a depression, we lose appetite, and we have anxiety, and we eat a lot, or we have to, or if we eat less. That's in my case. And I have to pay attention to that. And I just found a couple of publications regarding mental health, and I didn't have time to look for more, but there is a new field called nutritional psychiatry regarding nutrition and mental health. And I checked on clinical psychology and APA, American Psychological Association, how it mentions this to a couple of years ago. So now, since we are all worried about our immune system, and we all know deeply that what we eat is what we are and how we feel. Let me introduce you, Diego. Diego is a bachelor in clinical psychology, and he decided to go to London. What's the name of the institution that you went to study biomedicine and nutrition? Diego, remind me.
Yes. Hi everyone. And yeah, it's called College of Naturopathic Medicine, London.
And then you study Ayurvedic, right? So let Diego go ahead, Diego, and tell us about all the tips and all the knowledge that you can share with us. Thank you so much.
Thank you, Patricia, and thank you everyone for hosting me today. I'd like to make today's topic open to any question or interest you may have, because it's a very extensive topic, very broad, and I just brought some ideas to share with you. And first of all, when I was studying psychology, I became deeply interested in nutrition as a way to change my experience and also my mind. And I started reading about nutrition and experiencing myself. I was very young. I still am, but then I was like 18 years old, and I experienced major changes in my mind, like reduction of anxiety, better concentration, better sleep, higher energy levels, and so much more. So then my final assignment, I chose a correlation between psychology and psychopathology and nutrition. And then I discovered a whole world in PubMed relating like nutritional deficiencies and some disorders. But I became more interested in how we can achieve well-being, not just get rid of disorders. And I started studying naturopathic medicine in London. There, that discipline is completely linked to science, and I like to be in between science and alternative ways of healing, like ancient medicines, traditional Chinese medicine, Ayurvedic medicine, because I can clearly see the link between those ancient remedies and nutrition and science through studies. Like every time we have more and more scientific studies linking science, like chemical components in the body and the way we eat. So from this perspective, I'd like to share some ideas with you so we can discuss together. Okay, so I'm going to share some ideas. We can deepen into any of them that you'd like to. The topic is called Nutrition in COVID Times, a simple plan to improve your physical and mental health with nutrition and natural remedies. Today I'm going to maybe not discover you or just to introduce you to a whole new idea and a whole new perspective I like to bring to people, which is not only nutrition is important, only what we avoid, also what we avoid, and also the importance of getting rid of some toxins we have in our systems. And those toxins, I will explain, are physical, are manifesting in a physical way in the body, but their origin can be emotional, mental, spiritual, and other layers. So I am a psychologist and a holistic nutritionist. Holistic nutrition means I work relating nutrition to the mind, to emotions mainly. So in the first interview with my customers, I ask a lot about their lives, their emotions, traumatic experiences, so I can know what blockages they have in their bodies, what systems do not work properly, and how to improve their well-being by changing and improving the function of these systems in the body. So it's like a very simple but profound approach in my opinion. So the food we eat greatly impacts our emotional well-being, our cognitive functions, our happiness, and first of all, our physical health. So I put it in the other way around. So everything would start with our physical health, and then it would build up to our emotional self, and then our cognitive functions would improve, and then our well-being, our general well-being would be improved. So I think in our society we tend to separate physical health and mental health, and there is not much general and public knowledge linking both. So that's my passion, bringing both together and explaining in a very simple way how physical health, emotional health, and mental health is exactly the same thing. No separation between them. So if you improve your physical health, emotional health is going to be improved, and your mind and your abilities and your capacities are going to be improved, and we can work in both directions. We can work from the mind. You know about this as psychologists, and you can work from the body. So, and you can work in both directions. I think that's the strongest way to help people. So if we control what we eat and drink, I think that's the easiest way to take care of our well-being, because sometimes getting in for people or for the general public to get into psychotherapy is not the easiest way or the starting point. So they can start changing their diet, or maybe exercising, going out to nature, getting sun exposure, some simple things, and they can start seeing some improvements. Obviously, if there is some major thing in their life, something that is causing great suffering to them, maybe it's not greatly improved by doing these things at the first time. But these things start making other things like emotional or deeper things more conscious. So when we start bringing physical changes, also we start seeing sorry for my English, because it's a bit rusty. I haven't been speaking English lately. So yes, with physical changes in your diet, exercise, daily habits, you can start bringing some deeper issues to the conscious mind, and then the person becomes interested in psychotherapy. That's my opinion. So this is something that came to my mind today when I was preparing this. We've been bombarded with messages of fear, stress, scarcity, and sickness for over a year now. When we are victims of the system we live in, we lack control of our well-being. When this happens, we are dependent of a medical system and a government to protect us from any harm, which is the easiest way of giving the control of our natural birthright, being healthy, to others. I don't know if this super long sentence made any sense, but here I think for improving our well-being in general, physical health, there has to be some shift in our motivation from giving control of our well-being to others. It can be even a therapist, or it can be a hospital, it can be the media, it can be the government, to ourselves. It's not someone that is going to bring us joy outside. It's not someone that is going to force us change our diet. We have the deeper changes come through self-motivation. So I just heard that the group is related to COVID, and I was putting all the subject related to the times we live in right now. So fear, stress, and all other conditions create much imbalance in the inflammatory response. That's the key subject I want to talk today, and I think is one of the easiest ways to understand how to improve our well-being, reducing the inflammatory response, which sometimes is overstimulated. I'm going to explain about the inflammatory response right now. Well, it's not here. Yeah, sorry. So inflammation is a natural response in our body created by the immune system. Not many people know about this, but it's just there in science, in Google or in PubMed. You can see one of the main functions of the immune system is to create an inflammatory response, which is to bring immune cells to some areas of the body where there's a threat, like a pathogen, like virus, bacteria, and also toxins. Toxins. It can also be an accident you've had, and you've beaten yourself against a chair or something, and then there's an inflammation response in that area. Also, emotions created by an exposure to some danger or some stressful situation create inflammation. That's inflammation against some type of threat you perceive, like a virus, for example, and then you're constantly worried about it. That worry and that fear is chemical. It's not. It's you as psychologists and students of the of the brain and nervous system, you know about this. All these responses are you can find them in the body in form of cortisol, adrenaline, noradrenaline, and so forth. So those chemicals also are related to an inflammatory response. So when this inflammatory response becomes chronic, it's called chronic inflammation in the body, and it's associated to every symptom, physical symptom, emotional symptom, any type of symptom. Behind it, there's inflammation. So today I'd like to talk about one of the main things that cause inflammation, which is a toxin. Why is it? I don't want to talk about viruses or bacteria or parasites. It's because those do not tend to cause much inflammation. This is something that is not out there in the media, obviously. Like toxicity is everywhere, and it's better to panic about a virus than to panic about pollution, you know, because pollution is everywhere, viruses are also everywhere, and they've always been, but only now seem to be important and to be of threat. So toxins are in the air we breathe, the emotions we feel. Emotions manifest as neurotransmitters in which can be toxic in excess, and hormones like cortisol, adrenaline, and so forth. The food we eat, the disposal byproducts of our metabolism, that's natural waste products like CO2, the water we drink, and electromagnetic fields. For example, there are much more, like for example, the cosmetics we use, put on our skin, on our hair, and so on. So we are surrounded by toxicity. So what's a toxin? And there can still be people out there that doesn't know what a toxin is, and maybe think it's like a trend to talk about toxins and to do some just cleansing, weird just cleansing to get rid of them. But a toxin is just a chemical substance that impairs a system, the function of a biological system. For example, it can be the lungs. You know, when you breathe smoke, that's a toxin, and that blocks the normal flow of oxygen in our lungs. So that would be a toxin, for example. And also CO2. If you stop breathing, our body generates more CO2, and then start some chemical reactions that are detrimental to our health. So toxins create a constant and excessive inflammatory response in the system. This leads to all kinds of symptoms, as I said, such as insomnia, joint pain, digestive disorders, irritability, fatigue, immunodeficiency, and depression. Those are some examples. You can think of much more. Some of them are easier to relate to some toxins, and some others are more generic, like for example, depression or irritability, but you can trace the origin in the body to toxicity. This is a way of looking at it. So now I'd like to open a system which I created for a supplement company I just launched into the market here in Spain. And it's based on a holistic way to improve the well-being through nutrition. So this gathers all the information in natural nutrition and holistic therapies, including every modality. And I created three factors or areas to improve. It's not steps, so it's not starting with one and ending with the third. You can start with third, which can be psychotherapy or down regulating stress, or you can start with first, and then it's like a circle. We have to see this system as a circle. So first point would be detoxification, get rid of toxins, physical, emotional, mental. And here I'd like to make clear that it's not only physical toxins we can get rid of with natural remedies, diet, and exercise. We can talk about that right now, but also emotional and mental. So for example, toxicity is about getting rid of something that is bad for us. It can be a relationship, it can be bad company, it can be a job that is not for us and is creating much stress in our life. It can be removing some food we eat that is not good for our stomach or our guts, or it can be not exposing ourselves to content or to, I don't know, to some sort of information that creates fear or stress or whatever. For example, I sometimes recommend people to turn off media in times such as this, because it does not do any good, in my opinion. And that would be some type of mental toxin, like let's call mental toxin, something you watch, you hear, you expose yourself to that is not good for you because of your reaction. Then second is nutrition. Here, this point is the most commonly known. So even if I call myself a nutritionist, I work in those three levels, because nutrition is not enough to change our to improve our well-being. It's not only what we eat that improves our health, because we can change drastically our diet, but if toxins are inside, we are living a life that is not meant for us, or we have great trauma inside of us. Nutrition is going to do something, but the bottom of the iceberg is still there. So it's not just nutrition. So with nutrition here, I mean to build resiliency in our body and a baseline energy level, which is vitality. So here, when we are vital and when this baseline energy level is high, we can face stressful situations and stress in our daily life in a much better way. Our immune systems can deal with more toxicity and with more stress and with more traumatic events or whatever, and also can our body can put more energy in our cognitive functions, like concentration, memory. It can be any function. So third, it would be the mind, and to summarize, it would be to reduce stress, because we don't live in a society that has little stress. You know, maybe some other societies would have the problem of not having stress, you know, like indigenous people laying down but not even in those societies. Like everyone needs to be less stressed in their daily life. Why? Because stress is inflammation, and with inflammation we don't rest at night, we accumulate toxicity, nutrition doesn't reach our cells because we are in the sympathetic response, and in a sympathetic response, nutrients don't reach the depth in our body that they should. And also, as I told you, stress is related to neurotransmitters and chemicals in our body that are toxic, are neurotoxic in excess, like for example cortisol and adrenaline, and you know, much more. So here in this level, we would also work with therapy, psychotherapy, change of paradigms, like any type of cognitive therapy, and also life-changing through any type of activity, like for example yoga, meditation, reading, sharing in groups, doing calls like this, whatever. So I don't know if you have questions or any interest in one of these levels, like for example nutrition. That because I'm explaining this very like general. I'm not opening like I'm. Maybe you were expecting like eat this, eat that, or wake up at this time or other, but that's very broad. So I'd like you to ask questions if you're interested in something. For example, I bring ways we can start to reduce inflammation in our body, which would be diet. There is a diet called anti-inflammatory diet, promoted by Dr. Andrew Weil, very famous in the States. He invented or created that term, anti-inflammatory diet, which is not vegetarian, it's not vegan, it's a diet that reduces inflammation. Okay, so if you're interested into that, I can open that to discussion. Also earthing is walking barefoot in nature, in the beach, in the woods, in our backyard. When we put our feet, this is science proven, when we put our feet are barefoot in the ground, it is proven that negative ions and flow from the earth, which is negatively charged, to our body through our feet, and we discharge positive ions, which are related to stress, inflammation, toxicity, and all those conditions. There's like an exchange, energetic exchange, and that is proven to reduce inflammation in a 60% in under 40 minutes. That is, for being a natural thing, not a pharmaceutical, it's very, very potent. Also, sun exposure. We are a bit disconnected of nature, and we all know that when we go to the beach, or people who live in the beach are a bit less stressed and a bit happier. And that's also related to sun exposure, increasing vitamin D levels, serotonin levels greatly, and also melatonin secretion at night. That's a scientific way of improving health being in a very, very simple way. Also, natural supplements. I work a lot with supplements. Supplements are, as you most know, natural substances like vitamins, minerals, antioxidants, and compounds derived from plants, mushrooms, and fruits, and whatever. They can also be made in a laboratory, and they help improve some functions in the body, some specific ones or some general ones, and I think they're important because our diet most of the times is not very, very complete, and we're lacking some nutrients. And also I work with them to recover from disease, because the system needs more of a specific substance. Also, detoxification therapies. Detoxification therapies work reducing toxicity in the tissues in our body, like the three main eliminatory organs: the liver, the large intestine or colon, and the kidneys. When we clean through natural methods these three organs, energy levels, vitality, well-being in general improves greatly. And this is in my experience, and yes, and knowledge. It's a scientific way of improving well-being big time. Why is that? Because when we clean and detoxify our liver and gut and kidneys. The production of neurotransmitters such as serotonin improves drastically. Why is that? Because bacteria in our intestines made 90% of serotonin. A depressed person doesn't produce much, its gut doesn't produce much serotonin. So when we improve that function and naturally raises, it really helps with also mood imbalance and our emotional well-being in a direct way. Breath work is in my field more and more trendy lately. Breath work is known to release emotional trauma. For example, holotropic breath work and pranayama from yoga, and just belly breathing, deep belly breathing, helps to move emotions, the energy in the body, and it creates well-being in also in a very good way. I don't know if you know about Stanislav Grof. Of course, you know Stanislav Grof works and has worked with holotropic breathing, which he created for many decades now, proving that it releases trauma and can work. One session of holotropic breathing can work as 10 years of psychotherapy. I don't know if that's exaggeration, but I've experienced it and I think it might be true in some cases. And also psychotherapy, of course, because if we can work through our problems and be more conscious about them, and we can work through them, we reduce inflammation and we also improve our health. It's well known. So this is all. I hope you enjoyed. As I tell you, you can ask questions and we can discuss any topic you like. I'm very happy to do it.
Thank you.
Thank you.
Diego, can you stop screen sharing so we can get back in a group?
Yeah.
Thank you. Patricia, do you want to handle the discussion? You have to unmute.
Thank you so much, Diego. Gracias. You've done a brilliant presentation. It has given us lots of information and wise information. So please go ahead, anyone who has any questions. Eric?
Well, thank you for the presentation. And the question is, from your naturopathic perspective, what kind of foods, if you think of clients you're working with, you know, what foods would be most harmful for them, for which type of person?
Wow, that's a profound question.
Or I can add, you know, what is the best for which type of person, but both? Because for most practitioners, they would not know, but what are some of the basic, you know, red flags we should be looking for which person?
All right. So first of all, I'd like to distinguish between three type of persons, and it's a very common generalization in for example Western nutrition, Ayurvedic nutrition, and so forth. It's fast metabolizers, slow metabolizers, and medium, like mixed metabolizers. So it's like three type of metabolic types. So there would be people with a tendency to gain weight, to move slower, to have like bigger bones and bigger structures. Those people need to for example, let's say, eat a diet that more or less increases their metabolism. What is that diet? Like a diet a bit richer in protein, less rich in carbohydrates, richer in many plant compounds such as antioxidants, and also be very aware of flavors such as spicy foods in a healthy way, sour foods and salty foods, because those flavors increase metabolism. Then there would be a type, a fast metabolizer, which is the typical thin person which cannot gain weight. Eats what he or she eats. It's impossible for them to gain weight. They work, their minds work super fast. They rush everywhere and they can deal with everything because their energy is all over the place. And these people should try to slow down their metabolism. These people are the ones who struggle more with stress levels, so they should calm their metabolism with foods that are slower to digest. So they could eat a diet richer in carbohydrates, also protein, but they should avoid stimulants. They should avoid much spicy food, spicy food, and yes, and also bitter food, because bitter food, every bitter food is known to increase metabolism. And also there would be medium people, people that is in the middle between those two. So you should find which type are you, and then discover how to adapt your diet when you find out. It's very easy to know. Like most people know, if I tell you this, most people will know which type are them. So there's sometimes also, like as I told, toxicity influences that type, because when there is a big amount of toxins accumulated throughout the person's life, that can slow metabolism, and it can bring someone from a fast oxidizer or a fast metabolism to a slow metabolism. So they have to detoxify and then find a new balance. You know, for example, the balance they had when they were young, that's the one they were meant to be their entire life. So it's common now to find people with a how do you say that, with more belly fat, and they're this thin, but they have a bigger belly. that means they have toxicity in their system. They should be this way, but they have tummy. So diet, yes, that's, yeah, I think it's that way.
Thank you. May I ask you something regarding psychological problems, like, for example, the depression, or and also in the field of teens and child psychology, which I mostly focus recently. So it depends on the age, right? On your developmental age, and also on the type of psychopathology or mental health problem that you have. Some tips for higher your spirit, being depressed, and avoid some kind of food or anxiety, for example, which post-traumatic stress disorder. So those are the main categories that I follow. Thank you, Diego.
I think nutrition is very important. Firstly, we'd have to improve the function of the gut and digestion, because depression means the body is not transforming the food we eat into serotonin. So to improve that, we have to work with the flora, with the bacteria in our gut. So first, we should eliminate foods that create toxicity in the gut, like processed food and refined carbohydrates, sugar. A diet that is very rich in meat or animal protein that creates a lot of inflammation, and we should introduce the teen or the young person to a richer diet, introducing more vegetables, fiber. Fiber feeds the bacteria, because it's not that protein or animal protein is labeled as bad, but when the diet tends to be just focused into that, as refined carbohydrates, animal protein, and sugar, which is the diet of many people that age, just because of their age and because of they follow what their colleagues do. They just focus on that, and that diet creates a lot of depression and lack of energy, motivation, and so let's first it would be improve diet, so we can improve our gut health and the bacteria balance. Then secondly, it would be to I would say it's very important nowadays to reconnect with nature. It's so important because we're surrounded by stimuli all around. We lack of sunshine just in summer. We lack of fresh air. We are forced to wear masks mostly all over. So people need to get out of also the electromagnetic fields. That's not very well like generally known, but Wi-Fi, cell phones, and all the electric pollution there is around greatly influence our well-being, because it changes our biology. It's studied, and you can feel it when you go to nature. That feeling of well-being is also because of the lack of electric and electromagnetic pollution. So those are two simple ways of improving that, and also there will be so much more ways, like for example some natural remedies to improve serotonin levels. For example, there are thousands. I can tell you. For example, taking probiotics, doing some cleanse of your gut. Like there are many waste products as you know, Patricia, in our gut. So when cleansing those, serotonin production is improved drastically. And also following a diet that is rich in colors and antioxidants and pigments found in food, like those compounds are what bacteria really love love us to eat. Like, for example, I can tell you a few of them, like cacao, red wine. You wouldn't give red wine to a to a teen anyway, but like fruits, many colors, veggies, many colors of veggies, nuts, seeds. Just introduce them gradually to those types of foods, and also encourage them to do exercise, because when you do exercise, as you know, endorphins rise, and people feel better when they exercise. Also, that's related to the energy moving inside the body. It helps digestion as well, exercise, and it helps oxygenate our brain also in a very simple way. Blood flows better to the brain. Toxicity in the brain, especially heavy metals, which impair a lot with mental health. Those are like I would say much worse than any other pollutant, because they stay in the nervous system, and they can create heavy metals can create even autism, and that's crazy. Just because of detoxifying from heavy metals, many disorders, mental disorders, can be diminished or even eliminated through just that. Even epilepsy, I never say correctly this name, HDHD.
ADHD.
Yeah, sorry, ADHD. So yeah, I would say research on heavy metals, because heavy metals, they are everywhere. Pollution from the cars, in food, in tap water, in drugs, also in vaccines, heavy metals are everywhere, in fish, and they accumulate in the body, and the body is not able to get rid of them. And those are the main pollutants of the nervous system. We have to get rid of them, and there are natural therapies to do so in a very easy way.
May I say ask another question? Do you know any mental health hospital or anywhere that have all this in consideration, in mind, like nutrition and how they work with this? I find that amazing and very important for our work, especially in our mental health unit for kids and teens. But we have to teach this to the parents, and that's harder.
Yeah.
Right? But do you
Yes.
know any institution that do this on the public anywhere? I don't know if here in Spain we have anything
We
like
have,
that.
I would say it depends on the country. Here in Spain, we have little of everything, because it depends on the laws of each country. And here in Spain, there are some centers which work with this, but they're not public. They're private clinics, and their professionals tend to be doctors or therapists, but it's like out of the system. It's not in the system. Maybe in the states they have more clinics such as this. In for example, in California, in Florida, I'm sure as well. In tropical weather places, you find many of these clinics. I can tell you names if you want. In Spain, there are a few places, but that relation between like clinical psychotherapy or a hospital and these treatments, very difficult. For example, I had a meeting last week with a cancer treatment center here in Madrid, and that they are also in Houston. It's called Anderson Clinic.
Mhm.
It's well known, and I talked to the nutrition the nutritionist from the Madrid center, and they use some natural therapies with their patients, so that's nice.
Yeah, I've heard about it, and I tried to contact them a few years ago, but never got the chance to have an appointment.
Yes, they work with, for example, but that's in cancer, and also it's very contradictory because they put in that meeting I discovered many things like it's completely contradictory. It's like they are using chemo and radiation, and then radiotherapy, and then they are giving vitamins and natural compounds that inhibit chemotherapy and radiation. So it's like, why wouldn't you choose one of them? Like, you know, radiation and chemotherapy like completely destroys every cell. It can be cancer or whatever, and the other compounds, like, at least they improve your, but when you put them together, it's like, okay, let's see if we have some result. So it's difficult to find like an official clinic that work just with natural or that combines, but also it's like small places. Like in the States, there are many. I know many places in the States, but in Spain, not many.
Wow. This has been very interesting. I don't think there are that many places in the States, actually. Maybe you know a lot of them, but the States are so large that they may be concentrated. Eric, I wonder if there are more, and I always think of California as being a place where there would be more. In Florida, where I live, I can't think of any place that where we have natural sunshine and the beaches, and that's all people think about. They really do not.
Well, there are two groups.
Yeah.
To answer, naturopaths are now a licensed profession in California.
Ah.
And that makes a big difference. And also the West Coast, such as in Portland, Oregon, and other places, there are naturopathic schools. So in fact, it's an upcoming profession in that sense. The other group that has overlap, although not completely, there's sometimes, if you think of the Chinese medicine perspective, we often just think of acupuncture, but in fact, that is only a very small part of traditional Chinese medicine. And usually that would include diet as well and many other things. So there's an overlap, although naturopaths is a specific profession, and I highly recommend. I think it's very useful. I would do that almost first as a way to optimize health.
I wonder if there's an overlap with physiatry. I know that there are schools of physiatry that are supposed to be following a more natural, holistic type. But again, it's not licensable profession down here. So it's
physiatry.
Well, I'm afraid we're going to have to stop. We're at 1 o'clock, believe it or not, or 12:59, so we will be soon. This has been fascinating. Diego, thank you so much for presenting with us. It gives us a lot to think about. I certainly wish we had more time. I'd like to ask some more questions, not about the depressive state, but because we're dealing with interpersonal violence, how that, using nutrition can help calm down, but maybe we'll bring you back for another discussion. I know Eric has had a lot of good information that he's been sharing with us as well from California. So this has been great. And next week, we'll be back again. I'm not sure what the topic's going to be, so it might be a big surprise. But look for our advertisements. We'll have them up as soon as we can. And we'll see you all, same place, same time, Thursdays at 12 noon Eastern time. And I wish you, for those of you who celebrate the holiday this weekend in the United States, I wish you a happy holiday. And for those of you who don't, I wish you a happy week. So take care, everybody. And again,
Thank you so much.
Thank you.
Bye-bye.